You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, adult orthodontics, and we're discussing specifically fast orthodontics with 6-month smiles. With us, we have an expert on the topic. She is Iowa's dentist, Dr. Mohan. Dr. Mohan, welcome to the program.
Thank you.
Now, we've had you on the program before talking about dental implants for denture wearers.
Yes.
Today, one of your favorite procedures.
Yes.
You say 6-month smiles.
Yes.
Adult orthodontics. For people that don't know you, tell us a little bit about your practice, who's your typical patient, and what are the different procedures that you do?
Yeah, my practice is in West Des Moines. We love where we are. It's a great location. It's convenient and easy to get to, and we've been there a number of years.
How many years have you been there?
We have been in that location for about 8 years. I was in a different location for quite a few years before that. So
okay.
Yeah. I've been a dentist for 17 years.
Is
so,
that right?
Yeah.
Well, good for you.
Yeah.
Good for you. And you told me one of your daughters wants to be a dentist
My
too.
daughter wants to be a dentist. Yeah. Yeah.
Are you excited about that?
I love it. It's great. Yeah, she'll be a phenomenal dentist. She has these beautiful hands, and she can do anything with her hands.
When did you know you want to be a dentist?
I was probably about 16, and my parents sat me down and said, "What do you think you want to do?" And I said, "Well, I don't know. I'd kind of like to go into medicine." And my dad said, "You know, do you want to have a family?" And I said, "Yeah, I'd love to have a family. Of course, I want kids." And I didn't know if I'd probably end up with 4 of them, but I love all 4 of my kids, of course. But he said, "Well, how do you think being on call and raising kids and all of that would be?" And I said, "Oh, that might be kind of challenging." So he said, "What about dentistry?" So I think dentistry would be great.
Do you like it more than you thought you were going to like it?
More than I thought I would.
Why?
Yeah. You know, I think I grew up thinking that work was work, and it certainly is. I mean, there's no question. Work is definitely work, but I think we change lives on a daily basis. I mean, it's huge changes for people. Somebody that comes in and doesn't smile, they put their hand in front of their mouth because they're embarrassed about how their teeth look, and then all of a sudden, 6 months later, after they have their teeth straightened, they're beaming, and they just it's a personality change. It's a change in. I can't tell you how many patients I've had come in that they either they talk with their lips over their teeth.
Even to you as a dentist?
Even in my chair, as we're talking about the problems with their teeth, they're just so conditioned that they have to hide, and they can't be who they are.
And we've talked before. I mean, the perception of these people that don't smile looks like they're moody or angry or depressed.
Yeah, bad mood.
When you say they're just hiding their smile.
They're just hiding their smile. They just don't want anybody to see what their smile looks like. So yeah, I mean, I like dentistry way more than I thought. And it's certainly work, it's a job, but it's great.
So, you know, I asked you and I interrupted you, but the different things you do, because you do more than just, and then I have a lot of questions about these adult orthodontics.
Right.
But I mean, what are the different things you do?
Right. Well, I have 2 other dentists in my practice who are amazing, phenomenal dentists. Of course, they take care of me and my family, and so I would trust them with anything, and they're wonderful. But they do more of the general dentistry in our practice. They do crowns and checkups and cleanings, and well, the hygienists of course do the cleanings, but they take care of our general body of patients, and I do. Do
you do root canals and things like that in your practice?
Do I? In our practice?
In your practice,
yes,
you do all those
yes,
things?
we do, of course. Yeah.
Extractions.
Yep, extractions and. Yeah, although I do more of those. I love to do extractions.
So you do more of the surgical procedures?
I do more of the surgical, yeah, and the orthodontics.
So what's the most popular procedure in your practice?
Oh, gosh. Well, we do a lot of 6-month smiles and Invisalign in our practice. That's really, really popular.
Okay, so 6-month smile, it's fairly new, right?
It's fairly new, yes.
It's adult orthodontics.
It's adult orthodontics.
So how does it differ from traditional orthodontics, and who's a candidate?
Yeah, so a lot of people are candidates. It's, of course, with 6-month smiles, it's all adults. Invisalign does encompass some teens, but they have to be the teens that are, you know, either the A/B student, or they have, they're just disciplined. I look at,
because you have to wear those a lot.
You have to wear them, yeah, at least 22 hours a day. You pretty much just leave them in, take them out to eat, brush, floss, and anything else that you need to do for a few minutes, and then put them back in. So it's important that the person wearing Invisalign is very, very disciplined. 6-month smiles is a little bit different because it's meant to be fast. It's meant to be a solution that's aesthetic, that feels, you know, it certainly feels and looks a little bit like braces, but they're clear. All the braces are clear, all the wires are white, so they blend in very, very well. A lot of people can't really tell.
But how is it different than the 6-month smiles?
Yeah.
How is it different than traditional orthodontics? Because I'm still not getting that part.
By and large, 6-month smiles is meant to make a beautiful smile. It's meant to move the front teeth, and most people have fairly reasonably good molar contact.
So just the teeth that are showing are moving?
Mainly, yes.
Okay.
I mean, we can move other teeth, but for the most part, we just do what looks nice.
Okay, and then traditional orthodontics
And traditional orthodontics is meant to put everything exactly into place. So you want everything perfect. That's what traditional orthodontics is.
And that's why it takes a couple of years.
And that's why it takes a couple of years. You're moving everything into and very meticulously moving it into place. Whereas we're very meticulous with 6-month smiles, but we want somebody to end up with just a beautiful smile. And we do what looks great.
Now, you are not an orthodontist.
No.
But you have been doing orthodontics for how long?
About almost 10 years.
Now, how'd you get involved, by the way? So is it's outside of dental school, you take courses?
Yes, you take a lot of courses, because you want to be totally dedicated to it if you're going to start moving people's teeth around. So actually, the way I got started is I had Invisalign myself. So I did Invisalign as I had what we call ortho relapse. It means that as a teenager, I didn't wear retainers.
Right.
So I had braces when I was a kid and then didn't wear the retainers, and then my teeth started to crowd back as an adult. So I had Invisalign, perfect solution for me. It worked very, very well. And then, my teeth were back where I wanted them to be as a dentist and as a person. And then Invisalign was great, and I integrated Invisalign into my practice because it helped so many people that were in the same position.
So your teeth just shifted?
Teeth just shifted.
Got a little crooked.
I know. I didn't think when I was in dental school, I didn't think that teeth would do that. I mean, I didn't think they shifted and changed. I thought they were like cemented, posts in cement, and they're not. They have a ligament that moves, and they shift and they change. So as I tell my patients, especially when we're talking about Invisalign or 6-month smiles, everything else on the body tends to go south. In the mouth, it tends to go this way.
So they move.
Yeah, they move and they crowd usually, no, almost always.
So you started just with Invisalign then?
I did, and I just saw patients just felt better when their teeth were straighter. By and large, it seems like for a long time we had patients that came in and their front 2 teeth were overlapped, and they didn't like the way that looked. It wasn't in harmony. It wasn't what they wanted to see. So we would move everything and make their smile just more symmetrical, look better. They felt better.
So with the Invisalign, you're doing a lot of whitening combination.
Yes.
Obviously, everybody mostly gets whitening.
Yes, almost everybody wants to have that more youthful, healthy smile that, I have patients all the time that they say, well, my teeth aren't white enough. And I look at them and I think, your teeth are really white. And they still want them whiter. So even people that have very white teeth want them whiter. So there's kind of a nice spectrum, and some people, just like people have different colors of skin, they have different colors of teeth. So some people that start out with teeth that are a little darker, they come, to a certain shade and they're happier. Everybody's happier with whiter teeth. I have not met somebody that's happy with dark teeth.
Okay. Now, adult orthodontics.
Yes.
Okay, we're talking about 6-month smiles today. So this is a big option. I guess you either have 20, 30,000, 70,000 here in California for veneers.
Sure.
To straighten teeth.
Sure.
Like an instant orthodontics.
Yes.
Or you can do something like 6-month smiles.
And there are
Tell me about that.
Yeah, there are certain cases that veneers are the perfect option for somebody, and that's what. But I would never put veneers on someone unless that's exactly what they should have. I mean, orthodontics makes so much sense, and Invisalign and 6-month smiles makes so much sense for so many patients because it's a permanent alternative. I mean, it's not something that has to be replaced like a veneer. Veneers are fantastic, but they will eventually have to be replaced.
They are a lot more expensive than this, right?
And they can be, yeah, absolutely. Oh yeah, veneers are more expensive than 6-month smiles or Invisalign. I think they're very reasonable cost.
So who's the ideal patient? I mean,
Yeah.
what kind of situations? Is it the 25-plus crowd? What are you looking for with 6-month braces?
Usually there's the 2 main categories of people that want 6-month smiles are adults that had braces when they were younger and they didn't wear the retainers, like me.
Okay, and their teeth have shifted.
Me, and their teeth have shifted, and so they want a reasonably fast solution. They don't want to be in braces for 2 or 3 years, which is, how I was in braces for 3 years when I was younger, and I didn't want I didn't want to wear braces again, but I wanted something that was reasonably fast. So Invisalign is a little bit faster. 6-month smiles, or Invisalign is a little more. It's conducive to taking them in and out. 6-month smiles is a little faster because we have all the control. We can move the teeth where we want to. So,
and some people could even be faster than 6 months?
Some people are faster than 6 months, yes, absolutely. I've had cases that are 3 or 4 months because it is very, very fast.
Now with Invisalign, and I know you like Invisalign.
Yeah, I like them both. They have different applications.
I've met a few people on Invisalign, and they both hated them. They said,
really?
If you eat 5 or 6 times a day, taking them in and out is a hassle.
It depends.
That's why the 6-month thing seems.
Yes,
and
it depends how people look at it. Some people look at Invisalign as a hassle. Some people think it's the easiest thing in the world. So I mean, it doesn't.
Okay.
Yeah, I thought it was very simple because I thought, well, I don't have braces on my teeth. I can just take them in and out when I want to. That's a huge treat. But you do have to be disciplined with it, and you have to do that, which is. Yeah, but 6-month smiles it's perfect for somebody that never had braces, always wanted them, that has, either a little bit of crowding or a lot of crowding, or I have patients that have spaces everywhere and those spaces close down very quickly and they love it. That's one of the most fun cases to do. It's somebody that's had spaces in between their teeth their whole life and they just...
Now in dentistry, I've interviewed a few people about this topic, but it seems to be a bit of a movement. I guess there's not a lot, probably less than 5% of dentists are doing this.
Yes.
But the ones that are,
yeah, we love it.
Are pretty excited about it.
Yeah, we love it. Well, we love it because it makes sense. It's realistic. And I don't blame a 40, 45, 50-year-old adult for not wanting to be in braces for 2 years. That makes perfect sense to me. In 6 months or 6 to 9 months, which is, the usual time frame, it makes perfect sense. That's fine. People are willing to do that. But 2 years is a very long time.
I know some, and by the way, are people worried it's going to make them look like, strange to have braces on? Is that?
Well, I mean, most of us want to look like a teenager again, right? Yeah, I know. So, no, most people aren't too concerned. I mean, if they'll consider doing 6-month smiles and going back into braces, they're not concerned about what it looks like. And it doesn't. It looks, I mean, they're clear. They look really good.
What do you like better, by the way, for the adult? 6-month braces or Invisalign?
It really depends on the case.
Are they about the same price?
They're about the same price, yeah. And we try and make them about the same price because I don't want somebody to decide based on, I want them to decide based on my clinical opinion, not based on the cost. So we try and keep them fairly reasonably in the same cost, although usually 6-month smiles is a little less.
Can you do some complicated stuff? I mean, people with really crooked teeth?
You can do complicated stuff, and you can do complicated stuff if patients are willing to be smart about it. The complicated, if it's really, really complicated, I want the orthodontist to do it. I don't want to.
Do you ever send people to the orthodontist?
Of course, absolutely. I mean, they're fantastic. They do a wonderful job. So,
what can an orthodontist say about this?
An orthodontist could say that there's a place for this. There are cases where an orthodontist is going to have an opinion that it should be done.
Because this is a different philosophy, right?
It's a different philosophy.
Because you're just moving the teeth that are showing rather than all of the teeth.
For the most part, that is true.
Okay.
Yes, yeah. So an orthodontist they were raised on a philosophy that is very absolute. It has to be perfect or I won't touch it.
Okay.
And so, but we understand that as adults, we see hundreds of patients every month in our practice, and very few of them have perfect teeth. I don't have perfect teeth. I mean,
they look perfect.
Thank you. That's very nice. They're
I guess those with the retractors.
Right.
On,
they're reasonable.
Don't look so
yeah, I know.
Nobody looks good.
My
enough.
midlines are a little bit off, and I mean, there's certain things that an orthodontist would probably still want to fix with me, but I'm not willing to do it. And so that's the difference. 6-month smiles is meant to be how can we do something that's a very great service for the patient, but it's reasonable as far as what the patient wants.
So why is it seems, it maybe that the bottom teeth seem to shift as an adult? Like if you're over 40, it seems like when you talk, only your lower teeth show.
Yes.
And the bottom.
Is that like a Dan Rather thing, right? The news people, you can only see their lower teeth.
So what's the story? Why does the bottom teeth seem to shift?
Yeah, it's
mine did.
It's very common, and it's everything moves in the mouth according to force. So if the forces are keeping, I mean, that's why retainers are so great, because they keep the force where we want it, and they keep everything. I always tell patients, especially women, that retainers are the easiest maintenance you're ever going to do on the body. There's no sweating, there's no dieting, there's no nutritional changes, there's nothing like that. You pop in a retainer and you wear it at night, and that's it. It's the easiest maintenance you'll ever do. So as long as people are willing to do that maintenance and just throw a retainer in at night, then you're good to go.
So these 6-month smiles, I mean, it's clear. There's not metal brackets, right?
No metal brackets, no.
It's white across the board.
Yep, clear brackets.
But traditional orthodontics, I mean, you can't pretty much get around those brackets that are colored,
correct, right?
Okay.
Right. Yeah. For the most part, I mean, there's either metal or there's clear, and orthodontists are comfortable doing the metal, and I think that's great.
Is veneers
great for kids?
Is veneering popular? Getting porcelain veneers popular where you are?
Yes.
Do you think some people are getting veneers when they need 6-month braces?
Definitely, definitely.
Elaborate on that.
I think that a lot of people think that veneers are a quick fix. And so they want something that takes a month or a few weeks to do. A 2-visit veneer case is a really nice, fun, easy case in most people's opinion, not in the patient's opinion. I mean, it's a very complicated procedure for the dentist, so you want to pick the right person to do your veneers. But time-wise, you're going to spend more time in the chair over time having them maintained and making sure that you're really careful with them. With veneers, you have to be very careful. That I had a patient that had, he was out tubing, and he has veneers because he had medication as a child that turned his teeth very brown. And so he was out tubing, and he knocked his front 2 teeth out because he, was tubing and was doing this, wow. And his, teeth came flying out because he's just a very active person. And so you don't have that type of maintenance where you could potentially break or crack something. And I think that's the advantage. And we live in a world that we want to be more natural. We want to be more, kind of health oriented. And I think that's why moving the teeth to an optimal position
and when
is
it's
better.
all done, by the way.
Yeah.
So you may have to contour them, bleach them.
We do a lot of contouring and we do tons of whitening. We do a lot of contouring. I mean, a lot of people have, as we get older, we chip things a little bit, or we don't like our teeth pointy in certain places, so we'll round them off a little bit. Women have rounder teeth. Men have more manly, straight, square teeth. So that's a manly thing when you have big square teeth. Yours are great. I love your teeth.
Are they? Well,
yeah,
thank you.
I do. Yeah.
Good.
And so anyway, we do a lot of, at the end of our 6-month smiles or our Invisalign, we do a lot of contouring so that everything looks just
How old can you be
right.
to get a 6-month smile?
I have had patients as old as 78 years old.
Really?
Yes.
78-year-old?
And there's no
Worried
limit.
about their smile
There's
at
no
78.
limitation. Isn't that great? The patients that I had 2 patients that were 78 years old, and they said, I've wanted to do this my whole life. I can afford to do it, and I'm going to do it. I don't think there's an age limit on what age you want to look and feel good. So they had their whole life. They regretted that they had never done something, and they just didn't like their smile. So I don't think I've ever had happier patients. They were thrilled that they had finally done it. They wanted to their entire life.
Now we talked on the phone on a meeting about this, and you said that. So I guess you get together with these dentists across the country at these 6-month smile meetings.
Right.
Is there really that much to learn, though? I always wonder about that because it seems easy.
It is.
But
our job is to make it seem easy for patients, but it's very complicated. And when you start doing, putting wires and brackets on things and moving things and using forces to move teeth, it's something that you want to be very sure you know what you're doing. So that's important.
So do you think when you go to the dentist, because when people go to a dentist, we talked about this over there, that if you go to a dentist that doesn't do something, obviously they're not going to recommend it if they don't do it.
No, they don't.
Most of the time.
Right.
So should you ask your dentist, do you do 6-month smiles?
Sure.
Is that, you actually say that to them?
It would be very hard for a dentist to understand if they haven't been to a course and they haven't learned what it's about. It would be very hard to understand that because it wouldn't make sense.
What, that it can be done so quickly?
That it can be done quickly, that it's something that patients really want and they really enjoy having that. It wouldn't make sense.
But if it were your own family member and somebody, their bottom teeth are really crooked, they used to have straight teeth, and you had a choice between Invisalign, I'm going to try to put you on the spot here, or 6-month braces, what would you do?
I think 6-month braces would be a lot more simple for the patient, if it was a family member. Yeah, it would be. Really, they're both excellent options. I don't have a huge bias one way or the other, but I definitely think for ease for the patient, 6-month smiles is easier.
How important is a smile, in your opinion? Now, of course, you're a dentist, and my guess is you think it's the #1 most important thing as far as appearance goes.
Sure. Well, certainly I do, but I've evolved into that over time. I didn't originally think that it was that important, but if I interview 2 candidates in my office, or for a job or something like that, if you interview somebody, you pick the person that smiles more. You pick the person that...
if one is not smiling, one is, yes. You probably want the person that looks happy,
and how many people
positive.
do you like their personality if they never smile? You probably just wouldn't like that person all that much. People that don't smile, you'd be a little nervous around and wonder why they didn't smile. So I think there's probably a million things that we could talk about.
Makes you more approachable, probably.
It makes you way more approachable. I like smiling at perfect strangers, so I'm maybe a little different. I do, because I want always want people to feel comfortable and, you know, make just life. I want to make life easier for people, right? So, but straightening a smile is a completely different thing because people. They feel different. They're a different person.
Like more confident.
They feel more confident. I had a patient that she, it happened to be Invisalign, but she could have easily been a 6-month smiles case. But we moved her teeth were spaced. She had big spaces in her teeth, and she didn't smile, and she would talk like this. And she came in about 6 months after we finished her Invisalign, and she said, you have no idea how this has changed my life. I'm making twice as much money. I'm so happy. My family's happy. I'm a better mother. I'm a better wife. I just feel better. I'm just a different person.
So if you don't like your smile, you should do something about it. I mean, that's your message here. I mean, if you don't like it, it's not for everyone.
I assume it won't change everybody's personality.
But I mean, if you don't like your smile, then that's the ideal person.
I think you owe it to yourself to do something about it. If you really don't like to smile, smiling is kind of like breathing and
you do associate, you know, now that you mentioned
and breathing
with
and
positivity, you know, with almost
so.
Sophistication.
Yeah.
When you see a good smile. My son is who works with me, you know, went to film school, and one of the things when you want to make a villain, you darken their teeth.
Right.
If you want to make the bad person, the evil. You make them have crooked teeth.
Think Johnny Depp as you know, the pirate.
Yeah, so, that's right. They have the crooked teeth.
And they're kind of interesting looking.
But are there that many people though that are self-conscious?
There are a lot of people that are self-conscious, and it depends on the person. Some people have little tiny minor things that really bother them that they absolutely want to have fixed as soon as possible. And then there are people that have lived their whole life with, you know, big spaces, and it just now occurred to them that maybe they would be happier with a different smile.
What about a gap right in the middle? Would you rather go bonding or the 6-month orthodontics?
Well, bonding is great, but it usually, if you have two reasonable sized teeth and you want to make them bigger, if you close that gap with bonding, then they're two giant teeth. So that usually doesn't look quite right. So it's closing the gap with some kind of braces.
So for somebody with a gap, one of the people that work here, by the way, they have a little bit of a gap. I never noticed it, but it bothers them.
Okay.
She thinks it makes her look like a little kid. Is that a perfect candidate?
That's a perfect candidate for 6-month smiles.
Because that's fast, though.
It's
How fast could that be?
That could be just a few months. I mean, literally 3 to 4 months.
Just bring them together, and then they have to wear a retainer after that.
Then they wear a retainer after that.
And then her life will be better.
Right, right.
Right? She'll make more money.
It's interesting, you know, that little gap that some people have in between the teeth, sometimes there's a muscle that is actually in between those teeth. So we take a little laser and we cut that muscle. It doesn't hold anything, you know, I mean, it doesn't do this. It's just a little attachment. And when we cut that attachment with a laser, which is a 2-minute procedure, then the teeth can stay together. So sometimes that muscle is pushing those teeth apart. So that's actually a pretty common thing that we do.
What are the frequently asked questions, by the way, when they come in about 6-month ortho?
Pain.
For the adults. We're talking about the adults.
How much does it hurt? A lot of people are concerned, you know, that they're not going to be able to eat anything, or they're not going to be able to function because their teeth are tight. You know, you always hear about people getting their braces tightened. So when you tighten somebody's braces, you know, it's sore for a few days, no question. So people eat a little softer food for a few days, and that's
Is this
not a big
mostly
thing.
women or men? Both.
You know, it's both. Yeah, you would think it's probably mostly women, but you'd be surprised how many men we have.
So your hygiene team.
Yes.
Are they the ones that are suggesting, hey, you should consider this, or?
In my office, there's almost everybody in my office has either had Invisalign or 6-month smiles because, again, they want, I mean, you know, if they have the option, they want to have something done. So my feeling is that if cost were not an option for anybody, or, you know, an issue for anybody, everybody would have it done, because everybody in my office, when, you know, I take the cost mostly out of the equation, they all do it.
But how is this, though, that if you have crooked teeth, let's say on the bottom, and you're, you know, 35, how does that, because we talked a little bit about it, but how does it cause potential tooth decay? Or early tooth loss? I don't understand that. I mean, how could that be?
Can you brush between these? You know, is that a possibility? Well, in flossing, you could certainly clean between them, but it's much harder to clean teeth that are, you know, this way versus this way. That's very hard to clean. So it makes everything in harmony, and people can, when the teeth are straight, then the forces are even on those teeth as well. So those, you know, the teeth that are overlapped, they're not functioning like they should. So, I mean, we do restore function. It's not just appearance. We restore function with 6-month smiles.
What do you mean function?
So when we move teeth around, our goal is obviously to have everything look nice and be straight in the front, but we also want the teeth to fit together properly so that we balance the forces with these muscles and with our joints, because we're not just smiling with teeth, we're chewing with them, and we're using
So you
them.
have a little bit of training, I guess.
A little bit.
In the temporal mandibular joint, or
right.
TMD. I mean, you
TMD.
lecture.
Yes.
You teach dentists about
Yes.
bite, you call it, or
Yep. I teach dentists how to balance the forces in the mouth. I mean,
Okay.
you know, and how we want to make sure that we're not putting teeth together. I mean, you know, if your teeth fit together and they don't come, and you're putting too much pressure on one tooth versus the whole arch, then you're going to have problems.
So it's more than just straight teeth.
It's a lot more than just straight teeth.
So you got to go to a
Yeah.
dentist that understands all
Yeah.
of this.
Yes.
But how do you know? I mean, what do you ask the dentist? That seems
don't
like. I mean, the
know.
assumption is that you all are doing the same thing.
That is a good. I mean,
Right?
that's. I would say that's the assumption that most people make. But it's you know, you
It's
want to
just not
find
true.
I think you want to find somebody that's always learning. So somebody that's always, you know, if you're gone at course, if your dentist is gone at courses, that's a good thing, right? If they're always kind of on the golf course and they're hanging out and they're never, you know, they're never out of town, then you want to be concerned about
Ask
that.
your dentist, how often do you
Yeah,
go?
yeah.
Oh, okay, well, thanks. I'm
Right.
just calling.
I'm just checking.
So traditional orthodontics, there's definitely a place.
Right.
This
Yes.
is just different, totally different.
No, orthodontists are amazing. They're wonderful at what they do. We refer a lot of patients to the orthodontist for lots of different things. They're wonderful.
So what do you want orthodontists to know about what you're doing with this, with 6-month braces?
It is very similar to putting veneers on teeth. We're just taking care of the teeth that are showing. And
Good way to put it. Okay.
Yes, yes.
Final message. We're out of time about the 6-month smiles.
Well, it certainly wouldn't be for everyone, but it's for everyone that wants to feel better about their smile. And
Okay.
there's very few people that wouldn't benefit from straighter teeth.
All right. I want to thank you for coming on the show. Very, very good.
Thank you so much.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to watch this again, you just caught a certain part of it, you can go on our website, put in Dr. Mohan, and you'll find her there talking about 6-month smiles. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.